Health facilities have been reduced to ghost towns following the industrial action by health services workers. The usually busy outpatient departments are virtually empty, with no activities. There are no winding queues, just empty spaces. Few nurses idling around take time to speak to some patients caught up in the strike. Many patients had no prior information of the strike by members of the Health Services Workers Union. This woman brought her sick baby to the Akuetteh Teaching Hospital but was shocked to see this empty space.
I came for a review. My child had a surgery, so I came for a review today. Unfortunately, they are not around because I thought I was coming to see the doctor as they've already given me a date. But when I came and I saw that nobody was around, I was shocked. The place is always busy. So many chairs, you see the place busy, doctors going around, nurses working as usual. But today the place is empty and I'm quite disappointed.
The leadership of the Health Services Workers Union is satisfied with the high level of compliance by members. Douglas Kusi is the local branch chairman at the Akuetteh Teaching Hospital.
Virtually the hospital has become a ghost town. And if you come here every other day, I mean how busy, especially where we are standing here. And if you look at today, then it means that it's a very pathetic situation, you know, for all of us. But the question that probably you ask yourself is that who do you blame? Is it the Health Services Workers Union or government? And I'm sure your guess will be as good as mine. Because, you know, we are giving government adequate notice. In fact, if you look at this, the reason why we are even on strike, in fact, the negotiations started since 2019. What has even pushed us to take this action is that we feel that we are being discriminated against. In fact, if you go around the hospital, it's not here alone, everywhere, you know, activities have come to a halt. But I feel that it's very sad because as for sickness, I mean, all of us can fall sick at any point in time. But there's nothing that we can do about it for now.
Meanwhile, management of health facilities, including CARTS, say they have instituted measures to ensure patients with emergency needs receive care. From Kumasi, for Joy News, Wahimi Teria reporting. Health facilities have been reduced to ghost towns following the industrial action by health services workers. The usually busy outpatient departments are virtually empty, with no activities. There are no winding queues, just empty spaces. Few nurses idling around take time to speak to some patients caught up in the strike. Many patients had no prior information of the strike by members of the Health Services Workers Union. This woman brought her sick baby to the Akuetteh Teaching Hospital but was shocked to see this empty space.
I came for a review. My child had a surgery, so I came for a review today. Unfortunately, they are not around because I thought I was coming to see the doctor as they've already given me a date. But when I came and I saw that nobody was around, I was shocked. The place is always busy. So many chairs, you see the place busy, doctors going around, nurses working as usual. But today the place is empty and I'm quite disappointed.
The leadership of the Health Services Workers Union is satisfied with the high level of compliance by members. Douglas Kusi is the local branch chairman at the Akuetteh Teaching Hospital.
Virtually the hospital has become a ghost town. In fact, if you come here every other day, I mean how busy, especially where we are standing here. And if you look at today, then it means that it's a very pathetic situation, you know, for all of us. But the question that probably you ask yourself is that who do you blame? Is it the Health Services Workers Union or government? And I'm sure your guess will be as good as mine. Because, you know, we are giving government adequate notice. In fact, if you look at this, the reason why we are even on strike, in fact, the negotiations started since 2019. What has even pushed us to take this action is that we feel that we are being discriminated against. In fact, if you go around the hospital, it's not here alone, everywhere, activities have come to a halt. But I feel that it's very sad because as for sickness, all of us can fall sick at any point in time. But there's nothing that we can do about it for now.
Meanwhile, management of health facilities, including CART, say they have instituted measures to ensure patients with emergency needs receive care.
Union. Good morning to you, Eugene.
David, good morning.
From Kumasi for Joy News.
Keeping us.
Why me too?
This week, Charlie, Mama, new news.
Oh, David, when we shut it down.
Oh, me who that? She got the trade on Join us on Facebook and check out Eugene on stage to looking handsome this morning as he is ready to share with us what he's been able to find by way of fact checking. So go ahead, sir.
So, David, we have numbering up to 64. The people who form part of the health services workers union who are embarking on strike. And David, when I went through the list, Charlie, the entire hospital staff are on strike. So let me just give you some of them. You have nutrition officers, you have oral health officers, you have disease control officers, you have health promotion officers, health information officers, you have medical physicists, you have radiographers, you have human resource, physiotherapists, health records, procurement officers, health administrators, estate managers, dietitians, sonographers, optometrists, occupational therapists, prosthetic and orthotic group. If I don't pronounce the word, please forgive me, I'm not a medical person. You have pharmacy technologists, you have pharmacy technicians, you have health services drivers, you have supply chain officers, you have public health officers of all categories. You have opticians, you have accountants of the health services workers union, you have catering unit administrative managers, secretaries, artisans, dental technicians, diet cooks, field technicians, health tutors, hospitality managers, hoteliers, hostel wardens, IT managers, housekeepers, laborers, laundry workers, lift operators, mechanical engineers, executive officers, mortuary workers, mortuary workers, electrocardiographer, that's the I think it's called the ECG technicians, the HIV coordinators, dispensing assistants, security men and watchmen. David, 64 of them.
But if you look at what is written down there, it says what?
Etc.
So there are more.
Meaning that there are actually more.
There are more. Okay.
And David, you see, at the point where HIV numbers are soaring, coordinators are also on strike.
And indeed, Ashanti Region is leading.
It's leading. This is alarming. David, here are some of the outstanding. They say it's outstanding issue, meaning that it's not new. It's maybe it has been in the pipeline for a while. There are 6 of them. There are fuel allowance, accommodation allowance, uniform allowance, extra risk allowance, book and research allowance. David, security men do research.
So when I got this yesterday and I was going through it, I asked myself, so the mortuary workers, I'm going to book and research allowance here.
David, the
lift operators, I'm going to book and research allowance here.
Maybe they want to read on how to handle cops and all that. This is part of the work, David. The 6 is continuous professional development allowance, and this is very pivotal. In every profession, there need to be a scheme that will make you advance in whatever I do. But David, when you go to Ghana laws, I always say there are beautiful laws. When it comes to the implementation, that's the issue. When you go to Act 651, which is the Labour Act of 2003, it is clear, black and white, that you cannot embark on strike when you're an essential service worker. When you read the act, they've titled it Prohibition of Strike or Lockout in Respect of Essential Workers. That is Section 163 of the Act 651, which is the Labour Act of Ghana. It reads, and I quote, an employer carrying on or a worker engaged in an essential service shall not resort to a lockout or strike in connection with or in furtherance of any industrial dispute involving workers in the essential service. So it's clear. Now, which people, category of people fall under this section of the Act 651? So you go to the LI 1833, which stipulates those who are supposed to be part of this. So these are some of the people part of them. We have people from the Bank of Ghana, the Ghana Ports and Harbours Authority, the telecommunication services and all that. But what is important to this conversation is the C, where we have health and hospital services. So the LI, or the legislative instrument, that's the meaning, 1833, And also Act 651, which is the Labor Act of Ghana 2003, stipulate that health services, those who fall under the categories I listed, the security men and all that, those who ply their profession in and around the hospital cannot embark on strike. So David, how did you get here? The answers lies with them, and this is where I'll end with my submission.
Thank you very much, Eugene Osei, for joining us with those information, and we're live on Facebook. Please make time, log on to LUV 99.5 FM and see the state of some of the hospitals that we're talking about. See it for yourself, and then you tell us what you make of this strike action. Eugene, once again, thank you very much. We've been joined in the studios by some members of the union, and they are here to help us appreciate their situation. They are the Health Services Workers Union, and I've got Douglas Kusi. He's chairman for the Kath branch of the Health Services Workers Union. Good morning to you, Douglas.
Good morning.
And how are you doing?
Oh, I'm doing very well. I'm happy to be here too.
For a very long time I haven't seen you.
I see that one.
But good to see you.
Yeah, right.
So you can just lift it for me, so you can be comfortable. Good, good.
Thank you.
And we are in the studios as well with Stephen Kwame Mensah. He's a Regional Industrial Relations Officer, Ashanti Region, also belonging to the Health Services Workers Union. So good morning to you too, sir.
Good morning, sir.
And trust you're well.
By His grace, it's not all that well.
So help us appreciate how we got here. You know, maybe for somebody like me who is thinking that this law that we have talked about, the Labor Act 1833, bars you guys as essential health service providers not to embark on strike. So maybe if you speak to us, maybe we would understand and appreciate why we are here, why you guys are on strike.
Yeah, thank you very much for the opportunity. And then I also want to say good morning to our cherished listeners, as well as our members who are sitting at home trying to comply with the instructions from leadership. We want to assure them that they should stay at home until they hear from us. Now, coming back to your question about the LI which expelled us from going on strike, I think all of us has been in this country and we know what is going on. Doctors have been on strike.
And some of us have talked about it. We spoke against it.
Yes. Let's look at the law.
Before we get to the law, help us understand or appreciate how we got here.
Yeah, we got to this point because it seems that Health Services Workers Union and its members has been taken for granted for far too long. How can we be working in the same establishment and the very fundamental things that we are fighting for, like the accommodation allowance, the uniform, and so on and so forth, has been given to our colleagues who are already enjoying some of these things, and we are not being given? My brother, if you are a father and you treat your children like this, what do you think is going to happen in your family? There will be chaos, there will be misunderstanding, and it will not order well. All that we are, it's not our intentions, or we are not happy sitting at home. But the situation has pushed us this far. All that we are saying is that we are all workers. And so what is good for the goose is equally good for the ganders. Our Health Services Workers Union members, are we Burkinabes? Are we Nigerians? Are we from Kenya? No. We are equally Ghanaians.
So the argument is, in as much as you know that you're Ghanaians, what you ought to be doing is to sit at the table, have conversations with your employers.
My brother, let me give you the background. You see, we have an agreement with government. This agreement expired in 2016.
What was that agreement about? What did you say?
The agreement have a lot of things in. It's rather unfortunately I didn't bring a copy here, but when I get back, I can send you a software of that agreement.
A soft copy of it.
A soft copy of it, which talks about a lot of things. that has been agreed upon
In 2016.
in 2016.
Okay.
This agreement expired and it needs to be reviewed. We pushed government for this review from 2016. It was in 2019 that they responded.
What was the response?
The response that they call us for us to review. And even in the review, in the meeting, it wasn't easy. We had our first meeting with the negotiation team in 2021, just about some 3 weeks ago. And from the look of the negotiations, the body language of the negotiators shows that they have nothing good for us.
Who do you say the negotiators are? And for me,
That's our leaders.
If barely 3 weeks ago you have been able to go to table, it means that the process has begun.
No, I'm not. I'm saying that the agreement expired in 2016.
Yes.
We pushed from 2019. So the negotiation doesn't start from the 3 weeks that I'm talking about. It started way back in 2019. But government is dragging its feet. Government is dragging its feet.
No, this is David.
And we have to be struggling here and there.
Go ahead.
Until we find ourselves in this situation.
Okay. All right.
And so it is not that it is just these 3 weeks that we've got into this situation. It's as way back.
But what I'm saying is that when was the last time you had an opportunity to meet with your employers to have deliberations on this renewal of your conditions?
It was in this year.
3 weeks ago.
Yes.
That's what I'm saying. So if your employer, that's government, has started sitting with you, and let me come to you, Douglas. If government has begun sitting with you 3 weeks ago, that is some positive sign that government wants to listen to you and address your concerns. Isn't that what it is?
That's right. That's right. I mean, thanks very much. You know,
So if that is what it is, why would you want to go on a strike now?
Obviously. You see, I think that, we live in a country that the government of the day, in fact, not this government alone, but if government gone by and all that, the language they understand strike. And if you look at the nurses, in fact, as the IRO alluded to, in fact, if you look at currently the doctors, the nurses, the pharmacists and all that, they are all enjoying a renewed, new condition of service. But the health service workers union, as we speak, and like you are saying that we are the largest, group. I mean, if you look at the list that we went through, but as we speak, we are not enjoying any condition of service. But I mean, can you imagine if you are
you enjoy it, only it's expired and you want a renewal of it.
But what we are saying is, especially if I may cite an example, if you look at the fuel allowance, for instance, in fact, over the years, in fact, everybody, the doctors, nurses, and all that, the health facilities were supposed to pay. You understand? But I got to the point that they couldn't pay, and there were arrears and all that. So during their negotiation, they prevailed on the government. You understand that it should be part of their salary that government should pay, and government has done that. You understand? But as we speak, the fuel allowance, some of us, it's not everybody. In fact, if you look at the nurses and others, it has been expanded. The list has been expanded and all that. For us, it's not everybody who's enjoying, and even the few who are enjoying, it's the facilities who pay. And I tell you, if you visit some of the facilities, the arrears and all that. But I can imagine when we are working in the same environment, and then it appears that the discrimination, unfair treatment, and all that, I'm sure we'll not be happy. So we are compelled. In fact, if you go into history, I'm not too sure when the last time you heard Health Service Workers Union as a body going on strike. We hardly go on strike.
But my question is this.
Yes.
When was the last time you met with government before embarking on the strike?
Okay, so just quickly, see what happened was that, we've been negotiating, but I realized that government is dragging its feet.
No, hold on. According to the Stephen Kwame Mensah,
Yes.
you met
Yes.
3 weeks ago. Is
Yes.
that true?
Yes.
You met 3 weeks ago.
Yes.
As you continue to have deliberations
Yes.
upon your concerns.
Yes.
And so, if 3 weeks ago you have gone to table,
Yes.
isn't it a sign from government that listen,
That there's commitment.
there's commitment and that we are concerned, and so let's continue having a deliberation so we fix this once and for all? Do you think it is fair on the part of government that whilst you are at table 3 weeks ago, you have decided to embark on a strike action on Tuesday?
That's right. But the lead negotiator for government is Fair Wages Commission. Usually when you meet them, they'll tell you that they don't even have mandate to agree on some of your demands. We understand. In fact, as we speak, you know, the last time we met government was just was it 2 days ago or 3 days ago when we started the strike?
On Tuesday.
So, you know, we are saying that, in fact, government, in fact, if you look at even the nurses, like I said, they had to go on strike before their condition of service was implemented. So the point is that we have come to a point, and like the IRO said, this negotiation started from 2019. So can you imagine you are negotiating from 2019 up to date? You've not got into a consent. There's no agreement.
So you met with government on Tuesday.
Yes.
What was the outcome of that meeting?
Yeah. Okay.
Okay. On the Tuesday meeting was just for a meeting's sake.
What do you mean?
There's nothing fruitful has come out of it.
But you don't expect to attend a meeting and resolve issues on that same day.
Why do we meet? Then why do we meet?
No, you meet and you jaw. You have deliberations. If fortunately you're able to come to a conclusion, all well and good. But you can meet a couple of times and then you resolve the problem. That's why I'm surprised at the fact that you met with government 3 weeks ago and then you decide to embark on this.
My brother, people are suffering, and you are telling us to continue Jojo from 2019 up to date.
So for now, my tax as a taxpayer
Yes.
is used to pay you.
Yes.
And now I should suffer. Others should suffer. You heard the woman who says, well, I took my child to the hospital for a review and the place is empty. She's a taxpayer. She says she's disappointed. Should she be suffering?
My brother, there is an adage in Tree which says that Sebibi anka papa enyektere. So what happened? That we are on strike. We are giving you the background from 2019 up to date.
And you're not seeing commitment.
My brother, let me give you.
You're not seeing commitment.
Yes, we are not seeing commitment from government position. Let me give you a typical example of some of the lackadaisical attitude of government. When this pandemic broke out, we were given nice name, frontliners. So if you are coming to the hospital and we talk about frontliners, who is the first person to meet? Is it not the security man? If you have COVID, the security man who will interview where you are going before he directs you, is he not going to be contaminated? At the end of the day, what happened? All these people, those who will die. My brother, there are a lot of things going on in the health sector. And we have been talking. We have been patient.
So let's talk about some of the things.
Before that, if I may just add this quickly. See, running up to this strike, you know, the NEC, the National Executive Council of Health Services, we met. And then we issued a communique. In fact, in the communique, we came out with a roadmap. In fact, all the relevant bodies, government, represented by ministry, or even the office of the president, were copied. And we said that if by Wednesday, that's 2 weeks ago, yesterday, exactly 2 weeks, like yesterday, we said that if government, we didn't hear anything from government. You understand? So far, negotiations were concerned, or government, we did not start negotiation with government. In fact, we were going to the action, we listed the actions, red bands and all that.
And indeed, we're
going to kick in. You understand? So the government is fully aware of action. But like I said, we live in a country that the only language that government they appear to understand. And if you look at the history, we understand the doctors, the nurses need to go on strike before government will meet them. So I'm saying that we are not happy that we are on strike. But under the circumstance, because we can't live in the same environment.
Would you say you've gone through the processes of embarking on a strike? I know that you are essential health, service workers, and so therefore you don't have to go on strike. But even so, there are processes. Have you followed the process that would enable you, even if you were permitted to go on strike, to embark on this strike action?
In fact, we've exhausted all the lay down procedures. So as we speak, all the relevant bodies that we are supposed to inform, we inform them, so everybody's aware.
Including the Labour Commission?
They are aware.
I spoke to some of the leadership of the Labour Commission yesterday. They said they are not aware.
But quickly, if I may tell you, this one is not news. The Labour Commission, usually they wait. You understand? When you start strike, then they'll pretend as if they didn't know, but they are aware.
Let's look at some of the things that you're asking for.
Yes.
My brother, let me take you back to what my chairman has just talked of. You see, the Labour Commission, we all know that they want to dance to the master's tune. They were put there by government. So they will only stay. We have notified them, like he said. But they wait, and it happens to when the Nagrat and the rest embark on strike. They waited. You notify them. They will wait, and when you embark on strike, they will go to court to take place injunction on your strike, and they will tell you that your strike is illegal. If they know they don't want us to go on strike, when they were notified, what is their role as a labor commissioners? What role do they play to mitigate and make sure that whatever we are fighting for is achieved? They sit down aloof and look at when things go west, then they go to court. So we are telling them that they should also live us up to expectation, because the salaries they take are the taxpayers' money. So they should work in the interests of both government and then the workers. It is not that to say that they will only sit down and then be dancing to the master's tune.
All right, so let's talk about, your grievances and what you are asking for.
Yes.
And the 6 that I have before me, it will go for every member or every worker under the union. Yes or no?
No.
Say
no.
But
you see, health service worker, if you look at, when you went through the list, it's the most dynamic group within the health sector. Apart from the doctors, the nurses, and then the pharmacists, every other member of staff is a member of the health service workers union. But if you look at it, for instance, as I sit here, training and what? The
book and research allowance.
Research allowance, for instance.
And then the continuous professional development.
But some
allowance.
of them. So if you look at the training allowance, for instance, the book allowance, for instance. If you look at our colleague tutors at the training institutions, I'm talking about the NTC. Because if you look at the nurses, for instance, those who have MPhil, they take
the book and
research allowance. So equally our members who are with the training institute, the tutors at the training institutions, they also qualify. So this, that particular demand is for them. So if you look at it, we are saying that look at risk allowance, for instance, the risk allowance. For some of our members the work that they are doing, where they work, because of the risk involved and all that. And this one, if you look at the others who are also taking it. So we are not reinventing the wheel. In fact, our demands, is in line with the demands of the others. So we are not making any demand beyond, or our demands are not strange.
Well, this is Love 99.5. This is Love in the Morning. And we are speaking to leaders of the Health Services Workers Union. We have Douglas Kusi, he's chairman for the CAT branch. We also have Stephen Kwame Mensah, he's a regional industrial relations officer here in the Ashanti region. We're trying to reach the Labour Commission for them to tell us a few things. Unfortunately, the information I'm gathering is that the gentleman, we booked an interview appointment with him. He's not picking his line. We're still trying the lines to get a few more people to be a part of our conversation, so we get to have an understanding as to what the way forward is going to be. So under the situation, under the circumstances we find ourselves in right now, we have brought you the law. And you guys are into the essential service group. And therefore, you should not be on strike. You should not go on strike. Are you not lawful people?
My brother, if you talk about the law, we are law-abiding people. Okay? If you talk about the essential service, those who are not supposed to go on strike, we are not part.
How do you mean you're not part?
Yes. The law elaborates. In fact,
it says health and hospital service.
Yes,
and
there are categories.
You are in there.
There are categories.
Okay.
And I gave you an example. You are in this country. Don't you see doctors going on strike?
Are you justifying the fact that you are breaking the law?
Ask me a question.
Yeah. No, but you are saying that.
Yes, I must justify it.
They are health service, essential service providers as well. But the question is, when they go on strike, lots of people talk about it. We speak against it.
Yes.
So I'm saying, are you therefore justifying your actions?
I'm saying that when you look at the law, it groups. It's unfortunate I don't have my labor act here. It spelled out the group of people who are the essential services who need not to go on strike, and we are not.
You are not?
Yes.
What makes you say you're not?
You see,
you're telling me a while ago that when COVID came, you were referred to as frontline health workers.
I'm coming.
And therefore, you wanted to be recognized.
I'm coming.
Now we're talking about the law that says health.
I'm telling you.
You are into the health service. We're talking about hospital. You work in a hospital.
Yes.
And you're not supposed to go on leave and strike, and you are saying
I'm telling you that the law, when you read the labor law, it categorizes. Okay, it gives categorical people who are not supposed to go on the strike. You understand? The law capture hospital
and workers. It says health service workers and hospital.
And that is why I'm explaining to you that yes, I'm an industrial relations officer. I read the labor law. My bosses read the labor law. And if they know that this law, if we go on strike, we violate this law, they wouldn't have sanctioned this strike. And that's why I'm explaining to you that the law categorizes.
But like you said, doctors also go on strike, don't they?
So
if you're justifying it, I don't get the point.
That is why I want you to understand that yes, we have category of groups who supposed not to go on strike per the law as you carve it. And so if we have that law and you are saying that, then health services workers union members, you are also not supposed to go on strike. That's where my question comes. That are we not in this country where doctors go on strike? We even have, as far as to the categories that I have specified, prison officers. We were in this country where prison officers went on strike in Takrady.
If I may say this, you see, even, I mean, let's assume that health service workers union, our members, are essential. We are not supposed to go on strike. You see, if a government, when you are dealing with, employees who are essential, they are categorized as essential, and because they don't go on strike, your posture, the way you deal with them, should, manifest, that. It should conform to that. But like we are saying that, in fact, we started the negotiation not yesterday, very long time ago. So what do? And we are saying that we are working in the same setting, the same environment, where other, colleagues.
But you're not doing the same thing as they are doing.
No, but what
your services is essential and key, yes. But you're not doing the same thing as they are doing. But let me ask this question: yes. Have you been to the hospital yourself ever since you started?
Yesterday, when your reporter came, I was there. I mean,
fine.
I went to him.
So
yes.
When you were at the facility,
yes.
knowing how on a normal day,
yes.
the hospital setting is,
yes.
and the fact that the place when you went there yesterday was virtually empty,
yes.
Tell me, how does that make you feel, knowing and listening to this woman who says, well, she's disappointed. She has a child who has undergone surgery and had to come for a review. People who are sick, who have been to the facility, and you are not there to help them get, to see the doctors and get what is required of them.
My brother, we are not equally happy. We are not equally happy. My mother in the village can also get into such situation that this woman is going through. All that we are saying is that government should just listen to us for us to go to work.
So what will it take for you to go back to work? What exactly are you looking for right now?
If government today agrees and sign a memorandum of understanding with our leaders that yes, we have seen your cry, we have listened, look at your request and all these things, we have agreed, we are going to give them to you, go back to work, sign this memorandum of understanding. Today we'll go back to work.
Not that it is given, but it will be given. Then you go to work.
Yeah, we just want commitment from government that we are going to do it. In negotiations, there are a lot of things. Yes, you may have the will to give the thing, but maybe it's not ready at that time. So just give commitment that I have agreed with you. I can't give you today, but let's agree that tomorrow at this time I will give it to you. It's a commitment. But when you come with empty hand, that one will not be acceptable. My brother, we are not happy that we are in this situation. I tell you that we all wrote our applications to work to serve Mother Ghana. Does that not mean that we are coming to work or we want to use strike as a tool?
So as we speak, mortuary attendants or workers are also on the strike.
Sure.
Yes.
And so people have bodies at the mortuary and it's not being attended to.
That's okay. But
and like we went through this tall list.
Yes.
I'm wondering how the health facilities are right
definitely.
now.
So, like I said yesterday, when your reporter came, I was with him. And this one is not comfortology alone. In fact, yesterday I even described the situation as, quote unquote, more or less a ghost town. Because, I mean, if you came to Konfanochi before the strike, and if you how active the hospital is and all that, and if you went there today or yesterday, in fact, it's a very pathetic situation. And like my brother, the IRO said, we are not happy about the situation. But like I said, at the end of the day, you need to go to the market. So what do? You understand? So we feel that, and you know, the question you need to ask yourself is that who is to be blamed for this situation? Is it the Health Social Workers Union? Because government knowing the repercussions of, industrial action, when, any of the groups in the health sector, they undertake, strike. And you sit back. We have given you, notice now and then. You understand? So I'm thinking that it may not be fair to blame the Health Social Workers Union. I think that, government need to be blamed. But we also agree that indeed we are not happy about the situation. And like he's saying that, sickness is not a respecter of any person. I mean, as I speak with you, may God forbid, I can fall sick and I needed to go to the hospital. So if I go, there's nobody there. So we understand the situation. But we are appealing, in fact, we are appealing to government, and we are also pleading with the public that all of us need to bring pressure to bear on government. And then just listening to the health social workers, for once. And like our brother said, if they give us commitment and we know that they are going to pay, and they say that we should resume, why not? We resume, knowing very well that they are going to pay. So I think that we are doing our best, and we are really concerned about the situation.
Listeners, join us with your thoughts. Number to call is 03220 83596 03220 83596. I don't know whether you've paid a visit this week to any of the hospitals, the public hospitals. What was the situation like for you? You heard somebody say that, well, she had a child actually, who has undergone surgery, went to the hospital for a review. There was no, way she could meet with the doctor to attend to them. Quite, disturbing, quite worrying. Join us on 03220 83596, and we have Chris on the line. Good morning.
Yeah, good morning, David. Akuetteh, how are you, sir?
I am well, Chris.
Yes, David, this is a very pathetic situation that we are facing. To me, Dave, it's as if now in Ghana, patriotism, sacrificialism, and the love for our country and our jobs is missing. We all after money. Dave, if right now people are dying and the government seek to address their concern and give them the money, would that money be able to resurrect all these people who are dying? So they should be thinking about life first, and they should fall on their leaders to liaise with the Labour Commission. If you are saying that you started negotiations in 2016, 2019, but nothing has come out, then it means that your leaders are not effective. So you go to work, let your leaders have a dialogue with the authorities, and I believe that something pragmatic will come out of it. Because it is very unfortunate that as an essential service, you are on strike, and they are not even able to convince us vividly why the strike. I was following precept upon precept. I wasn't convinced about their reasons that they are giving. To me, I think their leaders lack that negotiation skill, or they are not effective. So they should go back. We beg them. We know that it is frustrating. It's on the bench. It's worrying. But they should think about the human lives first, and then they should go to work, and then watch.
Thank you, Chris, for joining us on Love in the Morning today. 03220 83596. That's the number to call. The line tripped. Let me try this one. 03220 83596. Hi, good morning.
Yeah, morning, Dave.
Yes, sir.
Yeah, Jekuma Adams, United States of Kopo.
Jekuma, welcome.
Dave, yeah, I'm highly disappointed in you.
Why?
People are dying and you are talking of legalities.
When you say legalities, I'm talking in terms of the fact that the law prohibits them from going on strike. So they ought to be at work whilst negotiations go on. Okay, if you have seen the video that we're showing you, the place is empty and people need to be
empty. Started from when? They told you the reason expired in 2016.
16 years.
Negotiations started in 2019. 2 weeks ago.
So you support their strike?
We also want them to meet. Ghanaians, we have to be serious. We don't value human life. Dave, you don't value human life.
So you support the strike?
I support the strike. What brought about the strike? Hello?
I'm listening.
What brought about the strike?
They've told us. I mean, they've had negotiations. There hasn't been any headway.
Aha. So what do you want them to do?
I hear you. Adeku Madam, thanks for joining us.
Well, this be factual.
Let's speak to George. Good morning, George. Hello, George. Good morning.
Yeah, good morning, sir.
And I hope you're well.
I'm well.
Good to have you, George. So, hold on, George, for me. So, I'm wondering, and this is in response to you, Adeku Adams. Are we saying that they cannot continue working and tell Ghanaians that this is what they've done from 2016? This is what they've done from 2019. This is what has not happened, and therefore Ghanaians should also speak. Just out of the blue, they get up and one day they say they're going on strike, and people go to the hospitals and there's nobody to attend to them. George, by the way, good morning to you, and let's hear you, sir.
Good morning, sir. This is my take.
Yeah.
You know, we are all in this country when doctors went on strike. I hope we were aware.
I'm listening, George. Go ahead.
Doctors went on strike for this same demand. And they were giving. Recently, nurses also went on strike, and they were giving. So ask yourself, why did the doctors went on strike? Why did the nurses also went on strike? So if the doctors can go on strike, if the nurses can go on strike, health service workers, they can't go on strike.
George, thanks for joining us too. 03220 83596. He says, well, if others are doing it and they're getting the results, why can't they also do same? Kofi Bedu, welcome. Good morning.
Good morning, Dave. How are you doing?
I'm well, Kofi.
Dave, I think this is why I agree entirely with the finance minister who says that the government payroll is full, and so therefore people should go into entrepreneuring. You see, people go in queue. Didn't they go in queue? They buy a form. The form is being bought. They buy a form to go and queue for a job, either immigration, military, police, or whatever. Because they will go in and enjoy all these allowances. The allowances are just too many. But who has bought all this? You know, those in the street are just the beneficiary of what we have made all this while. And they're supposed to get it. They are going to enjoy it. You see, I'm not surprised why we should borrow on every month. We should borrow to pay salary and allowances. Those allowances in your studio are not hiring for salary. Not at all. But allowances. Not one allowance, but many. Every allowances. If you go to advanced country, even your uniform will be deducted from your salary. When you are given a uniform to work, it will be deducted from your salary. Why are you going to do so? You know, this beneficial of what we have made and agreed is from the top. Right from the top. That is what is there.
Well, thank you very much for joining us, Kofi Bedu. Then again, I mean, let me speak to Charles. Good morning, sir.
Hello, good morning, Dave.
How are you, Charles?
I'm good by God's grace.
Thanks for joining us, Charles. Let's hear you, sir.
Okay, I just think these things they are not going to stop. They are actually going to get worse until we get people to work for the and the money they are craving for. Nothing is going to change. I think the government should start looking at paying people according to by the hour, and then some of these things will stop. You see that they will have money enough to pay those who are really working. A lot of people are making noise, demanding outrageous things, but they do nothing really. But at the end of the month, you still pay them. I think the government should have a look at paying people according to the hours they work. And I think some of these things would stop.
Charles, thanks for joining us, sir. We appreciate your call. 03220-83596 is the number to call us on. We know that Health Services Workers Union are on strike. The list is tall and they're on strike. I don't know whether you've been to any health facility, the public ones, how it's affecting you. Join us on 03220-83596. Alex, good morning, sir.
Good morning.
Welcome, sir.
Thank you. I want to ask the people in your studio. Now, after they have made all these arrangements, I don't want to call it noise because it is important to them. After they have made all these arrangements and getting what they are demanding, what effort they put in to make sure that their people are giving their best at their level? In Ghana here, when we want money, we make all the noise. You get the money, then you go and sit in the comfort zone. You sit in the office. When people come in, you are supposed to attend to them. We treat them anyhow. Is it the same effort that the people in your studio, the leaders, put in to make sure that their people are working? I want you to ask them that question for me, please.
Thanks for joining us, Alexa, with your contribution. 03220-83596. George, good morning and welcome.
Good morning, David. How are you?
I am well, George, but I'm worried. I'm wondering how people out there who are not well are feeling, knowing very well that, the Health Services Workers Union members are on strike.
David, it is true. I am pleading with them to go back to work and then continue talking. You said that you spoke with them 3 weeks ago. That means they are committed.
But again, George, to be fair and to be sincere, this, like they're saying, did not start yesterday. So if government sees them as essential health service workers or providers, why should we allow some of these things to drag till now?
David, it is true. Now, you say, David, I am pleading with them. And I am not convinced. You ask them so many questions. You are coming to the radio station to explain to Ghanaians, and you left some of your papers home. You see, the documents that will convince us to support you, you left them home. So please, I am begging them, David, for them to go back to work, to save lives. And also our leaders. I know that the health minister is enjoying everything that is due him. So as important as the health workers are, they must also listen to. They shouldn't also drag their feet. You see, our leaders, everything is in the pipeline. Everything is in the pipeline, and that is what is causing all this. So our leaders must also be up and doing. Thank you, David.
Thanks for joining us as well. And that was George. Okay, so we lost that caller there. I'm told now that we have the regional chairman for the Ghana Medical Association on the lines. Dr. Pakwesi Beidu is on the line. Pakwesi, good morning.
Good morning, David.
And how are you doing?
I'm good.
So I know you were listening and you called for your own purpose and reason, but before you tell us why you called, how is the hospital like right now with the absence of these Health Service Workers Union? How's the place like right now? How are you guys coping?
Yeah, David, good morning. Good morning to your listeners and great colleagues in your studio. I share in their frustrations, and it's the problem with the health service, and that's the reason I'll address your issue. The health service, as you said, is a teamwork, and I've always been emphasizing on that. I will not say because I am a doctor, so I'm more important than Abraham, or the Muslim. Each one has a role to play, and we do that as a team. Just like any football or sports team, that's how the health service is. If one aspect of the agency is not there, obviously it will affect the other. But we are here seeing vacancies, seeing possibilities, and all that. So as an answer to your question, is like a part of your the engine in your car is not working. Obviously, you are going to face challenges, and so that's the answer. But then I want to correct this erroneous impression my colleagues are trying to create. They have a point. They have every right to demand what is theirs. But please, leave the doctors out of your everything. The doctors did this, the doctors did that, and they were giving. David, if you remember, the Ghana Medical Association issued an ultimatum to government that if by 30th September, if we don't get full implementation of our service, we're going to stop work. We have to suspend it. And by suspension, it wasn't like we're giving, but then they committed themselves to negotiate. And indeed, just yesterday, we were at the Labour Commission, gave the Ghana Medical Association and our employer, that is the government, through the Ministry of Health, that we should conclude on it. And indeed, we also started negotiations about 3 years ago. And some things that should have been implemented since 2019 has still not been implemented. So the fact that we didn't go on strike didn't mean we giving all that we demanded. And indeed, the only thing we achieved, was to be given 2 scraps and then 2 lab coats every year. If that's what we call clothing allowance fair, and you can, it's in the 2 scraps. The scraps we wear in the hospital, and 2 lab coats, which most of us didn't have anyway. And the second thing was, we were demanding health care for our members. And indeed, the government responded, and it covers now. You see, our demand now covers every member of the hospital, and they will attest to this. Before this, if you needed services in the very hospital you work with, either you pay, or you have to write through your head, through this, to the medical director, who in turn will grant you either a waiver, or they will say, they will cover this percentage, 30%, 40% of the cost. The very hospital you work with. You get it? So most of us were taking care of ourselves, and I know who agree. They were even taking care of themselves. But through the actions, when we gave the ultimate, and I'm telling you, these were the 2 things we were among the about 10 or so. Now, every member of the hospital, now I don't need a waiver. If I have a medical condition, I don't need to write through that whole process for somebody to know that maybe I have diabetes, or I have HIV, or I have this, or I have that, before they will decide to pay this. And that benefited all of us.
But let me get clarity here. This benefits that you say workers are gaining or getting, first of all, is it for every public sector, health sector? And is it for every staff of the facility?
Yes. So this is for, if you look at all the organs under the government, SNIT and all those, they go to hospital for free, and they pay. We in the health sector, we're not getting it. And they will attest to it. Now, every hospital, the Ministry of Health has written, Ghana Health Service has written to that effect, and I think the Christian Health, that's the child hospitals, have also written to that effect, where now nobody needs a waiver. Of course, there's a ceiling to how much the system can cater for, and they are benefiting. So when we got this and we realized that they were committed to negotiate, and indeed, they showed that good faith. So we said, okay, since you have agreed after several years of dragging your feet to negotiate with us, we don't need to go on the strike. And the referee was the Labour Commission. So they said, okay, I'm giving the Medical Association and the government up to yesterday, 27th October, to thrash out the other issues that are left. And then we report back to them. And that's what we did. So yesterday we met.
So negotiations are still ongoing for you people. And you are okay. And that's why we keep talking about negotiation. Pakwesi, thank you so much for joining us. That was Dr. Pakwesi Beidu. He is the Ashanti Regional Chairman for the Ghana Medical Association. Let me pick just one more call, and then we'll be wrapping up. Kwame is on the line. Good morning.
Hello?
Yes, good morning.
Good morning, David.
Yes, Kwame, welcome, sir.
Thank you. David, I've been living in this country for about 2 years now, and I don't call health workers from a private hospital going on demonstration or on strike. I've never heard anything like that. Each time we hear of health workers on strike, it means they are from the public sector. The question I'm asking myself is, why the government continue to be the one in question this question? Can't the government hand their sector to private agencies? I think that's the way to go. The strikes are just too many. And have to take that.
Thanks for joining us, Kwame. And indeed, the strikes are one too many. Not long ago, we know that UTAG, embarked on it and all that. All right, so you have said to us already that the only reason or the only circumstance under which you would return to work is if you get a commitment from government. You're not even saying that they should say, well, we're going to start paying you at the end of this month or next month. But you should have something documented and signed, something that tells you that we have accepted your concerns. Yeah. We have looked at them, and then we are going to fulfill them for you. That's all you're looking for.
Yes.
Let's see what comes out of the next meeting you intend to have with your employers as a government. But if you listen to Dr. Akuetteh, he says indeed they had wanted to go on a strike on the 30th of September. Having met with the Labour Commission, they've come to understand that there are some things that have now been given to health workers, which of course you guys also are benefiting, where you are treated for free. Isn't that another sign of good faith from the part of government?
My brother, I share with Doc some of the things he has said, but in terms of free, it is not all free.
But that's why he says it's a cap to it.
It's been a ceiling.
Yes, he said.
But the doctors are treated free. They don't pay anything. But
you're saying for the doctors there's no cap on it?
Yeah, there's no cap on it.
I'll go check it out after the show today. I'll check it out.
There's no cap on it. But we health services workers, member, you are given 3,000, isn't it, Chairman? Yes. And after that 3,000 ceiling, when there's any extra cost, you have to bear it.
Well, we'll draw the curtains here.
But just quickly, I think that on this free treating staff for free and all that, I think that as Dr. Akuetteh said, if you come to Confanoche, is partially true. In fact, until 1st of October, if you were sick, you pay, and later on the hospital will refund the money to you. And there were delays and all that. So all the labor, the groups, the professional groups and all that in the hospital will make management. And they will pleaded that if indeed, like IRO say, you're entitled to 3,000 Ghana cedis, at the end of the day, the money will be refunded to you. Then why do you pay and all that? So as we speak, in fact, for Confanoche, if you are not well, when you go, you'll be attended to until you exhaust the 3,000. And after,
but if you look at your numbers,
yes,
across the country, yes, if you look at your numbers, yes, government has done something.
But we are saying that this one applies to look on.
We don't know. Well, I asked him whether it cuts across. I don't know whether he had me ask that question.
This for now, this for
well, I asked him, and he said it cuts across. Yeah, but all the same, thanks very much, guys.
But David, just quickly, the last point. You see, I think that as for the health service workers union, we have done our bit. In fact, now the onus lies with government to at least meet us and
that point has been made. Dave, let me say thank you very much to all of you. Thank you very much. Forgive me, Stephen. My time is far spent. Far spent. Thank you so much. And you heard Stephen, bless you too. Stephen Kwame Mensah is the Regional Industrial Relations Officer for the Ashanti Region. He joined us. And so did Douglas Kusi, who is the chairman for the Confanoche branch, also joined us for this conversation. Well, they're saying that all they are asking of government is commitment. That, listen, you've seen our request, you will, give it to us, and then they will go back to work. Thanks for being part of us, for listening to Love in the Morning today. We'll be crossing over to Joy 99.7 in a bit for more on the Super Morning Show. Please stay with us.